Now up next, we are trying to look at two types of cancer of the cervix, and this classification is just based on how they present. That's like if you try to observe the cervix, what you see. Okay, so the growth, that's the growth of the cancer cells, could be endophytic, or you call it ulcerative, or the growth of the cancer cells could be exophytic, or you call it a cauliflower. I think it's a cauliflower growth. Okay, so endophytic is more like it's growing inside. Okay, so cells are dying, they are becoming like scales, So in cervical cancer, tumor growth is basically in different patterns, right? So we recognize the endophytic, also known as the ulcerative, and the exophytic, also known as the cauliflower. So let's just quickly describe them. So endophytic now. So the growth is basically inward. The tumor growth is inward. Are you seeing it? So it's ulcerative. It's a crater-like lesion of the cervix. So symptoms is often associated with what? Bleeding after having sex, and the discharge is usually foul smelling. So maybe less visible, right? Because it's growing inside. Okay. So may lead to what? Early invasion and spread. Okay, spread is very easy, and there's higher risks of what? Hydronephrosis of the kidneys. Then exophytic, which is basically what the cauliflower is growing outward. Okay, so tumor grows outward from the cervical surface. It's irregular, friable, cauliflower-shaped mass. Okay, can I say it? So it's easily visible. If you check this one, you easily see it. Tends to bleed on contact. May cause obstructive symptoms if it is large. So may lead to vaginal obstruction or secondary infections. It's less likely to invade deeply because it's actually growing outward, not inward. Okay.